Hello students, myself Dr. Maddineni Srinivas. So in this video, we are going to see the previous year questions from INICET November 2022. So this is the first question. Are the clinical finding in the 10-year-old boy includes fever, joint pain, and hand lesion, which is showing erythematous papules over ICP and MCP joints. The examiner is asking what is the likely diagnosis based upon these findings. And so if you observe, this is a boy who is having these lesions associated with fever and the joint pain. So if you get this kind of a question, always you have to think about juvenile dermatomyositis, in which we are going to see these violaceous macular erythematous papules present over the ISP and also the MCP joints. Very, very important. They are called as Gottron's papules. And in this same paper, there was another question related to juvenile dermatomyositis. So somehow the examiner likes to ask related to this connective tissue disorder, where we are going to see some skin features and also some muscle features. What is a muscle feature? Myositis. So these patients are going to have a proximal myopathy, proximal muscle weakness will be there. And dermatologically, what are the various lesions which they can have? So one is Gottron's papules, which are able to see here, and the others are Gottron's sign, in which just violaceous macular erythema will be present at the same site, but there will not be any papillar lesions. What is the another one? Heliotrope rash. So remember heliotrope rash, in which there is going to be violaceous macular erythema surrounding the eyes, orificial, mainly periorbital erythema will be present. The other feature is shawl sign, where violaceous macular erythema is going to be present over the upper back, and V sign, which is the violaceous macular erythema present over the anterior chest. Holster sign, where the erythema is now going to be present over the lateral aspect of the thighs. So these are all the various signs and features which are seen in dermatomyositis. Okay, very, very important for you to remember. Now, just for the completion purpose, option B is telling rheumatoid nodules. So how are they going to present and where are they going to be seen? So juvenile rheumatoid arthritis, which is an autoimmune disorder in which we can see rheumatoid nodules as firm, painless subcutaneous nodules. So which you are able to see here, usually over the areas where pressure is more when compared to the rest of the body parts. So in the hands, you can see these are the areas where there is going to be more pressure applied while working and all during the daily activities. So this is the description of the rheumatoid nodules. If in future the examiner is asking you about these nodules, you know how the description is going to be. So they are painless nodules present over the pressure bearing sides of the upper limb. This is the next question, very, very important, repeated question. A pregnant woman at 12 weeks of pregnancy, currently she is taking MDT for leprosy. She now presents with type 2 lepra reactions. What is the preferred treatment for this patient? So please remember, whenever Hansen's patient comes with a lepra reaction, the first advice we need to give is to continue the multi-drug therapy. And in oral steroid usage, remember there is a confusion. Students think that in type 1 lepra reaction, steroids are used, and type 2 lepra reaction, it is thalidomide which should be used. But please remember, here it is a pregnant woman, and in pregnant women, thalidomide cannot be used because it is a teratogenic medication. So the answer here is going to be, we are going to use oral steroids. And remember, steroids are the drug of choice for both type 1 as well as type 2 lepra reactions. Very, very important point. Though thalidomide is the gold standard for the type 2 lepra reaction, we are not going to make use of the thalidomide. We are going to use the oral steroids for both type 1 and type 2 lepra reactions. And this is the next MCQ. So this is very controversial. Many students ask queries regarding this question even today. So my suggestion for all of you is there are two schools of thought. One school says that follow the latest guidelines even if they are not being taken up by the NLEP yet practically. And there is another school of thought which says that anyhow it is there in the guidelines. So most likely that is the reason why the examiner is asking this question. So you need to answer it according to the new guidelines even if it is not practically yet implemented. So follow any one school of the thought. My school of thought is that because it is already a treatment of leprosy, there is a update we can say in the latest leprosy roadmap. So according to that, I say that we have to follow the latest guidelines which are mentioned. So accordingly, I'm going to discuss this MCQ. So you are free to follow any one school of thought. Do not waste your time on this unnecessary small controversies, which will be like one question out of 100 questions. So ignore this one question, focus on the rest of the 99 straightforward repeat previous year questions which do not have any controversy. That is my suggestion for all of you. So the coming to the question, a patient visits the outpatient department with satellite skin lesion, and on examination one hypopigmented lesion and one thickened nerve are observed. Okay, so images of this blister packs are shown. So this is a straightforward a case of leprosy which the examiner is giving you clues. And these blister packs, which treatment would be the most appropriate according to the NLEP guidelines? So this is a question. Please remember the clues which are given in the question are pointing towards a paucibacillary leprosy. And in the paucibacillary old guidelines, NLEP would have been two drugs for 6 months. But of late, yes, as I have told you, there is a update. So you can see the National Strategic Plan and Roadmap for Leprosy. This says that we have to follow what the World Health Organization says. That is for paucibacillary and also multibacillary. 3 drugs should be used. The duration is the only difference between pauci and multibacillary. Paucibacillary 6 months and multibacillary the treatment is going to be for a period of 12 months. And the treatment regimen is going to be rifampicin 600 mg once in a month, dapsone 100 mg daily, and clofazimine the exact half dosages of rifampicin and dapsone is going to be used. So clofazimine once a month 300 mg and every day 50 mg. This is the treatment which you are going to use. So now according to this, what is going to be the answer for this question? It is packet 2 for a period of 6 months. Why? Because it is a paucibacillary type of answers. So you are free to agree and accept any one school of thought. Don't waste your time. Okay, do not waste your time. That is my sincere request. And this is the next MCQ. Chemoprophylaxis for leprosy should be given to which of the following persons? So this is we can say very important concept, chemoprophylaxis. So to whom are we giving this chemoprophylaxis with the single dose rifampicin of 600 mg? It is the contacts of the leprosy patients. So what are those criteria which should be fulfilled for us to give the chemoprophylaxis is what the examiner is asking us. So sharing the same clothes and towels is option A. So please remember this is actually a little bit controversial. So let us keep it positive or negative. The next option is living with a patient with leprosy for a period of 6 months. Yes, this is a criteria fulfilling for the to give the chemoprophylaxis. Contact of age more than 2 years. Yes, this is also one of the criteria. Contact for more than 20 hours per week. Yes, this is also important criteria. So if you look at the options, in the options you are having option C 2, 3, 4. 2, 3, 4 which are correct. So option 1 we can rule out and we can select the rest of the other options. But if the other options had some gross mistake in terms of the numbers or the which is not there in the criteria, then we can select the option 1, that is sharing the same clothes and towels. But otherwise in this particular question we are going to eliminate or rule out the option 1, and the rest of the 3 2, 3, 4 are the correct statements is what I want all of you to remember. And this is taken from the latest guidelines for chemoprophylaxis. So you can see it is living, working, or the social activities. The person who is in contact with leprosy must be living or working, or there should be some kind of a social activity for 20 hours or more per week for more than 3 months in the past 1 year. So this is the complete criteria which should be fulfilled for a person to get chemoprophylaxis. And of course, the age should be more than 2 years of age. And exclusion criteria, remember, this person who is a contact, he should not have any symptoms of leprosy, in which case we have to give this patient PB or MB leprosy, not the chemoprophylaxis. Okay. And also any contact who is a case of tuberculosis, they should not receive this chemoprophylaxis of single dose rifampicin. This is the next MCQ. You need to match the following scale types with their lesions. This is also very important. So let us try to answer it very carefully. Collarate scales, if you remember, they are very classical of pityriasis rosea. So it is small b, okay, pityriasis rosea. Silvery scales they are seen in psoriasis. Silvery scales they are seen in psoriasis. Mica-like scales are classically seen in pityriasis lichenoides chronica. Brany scales are seen in pityriasis versicolor. So answer should be B, C, D, A. So option A, B, C, D is the correct statement. Few points related to the scales in dermatology, very important. So collarate scales, it is classically seen in pityriasis rosea. In this herald patch, you are able to see this scale which is attached on the outer side and it is free on the inner side. This is called as collar-like scale or collarate scale. Fish-like scale, Ichthyosis vulgaris. Leaf-like or cornflake-like scales can be seen in this immunobullous disorder, which is Pemphigus foliaceus. Mica scales are seen in pityriasis lichenoides chronica. Pityriasis lichenoides chronica has mica-like scales, which you are able to see here. Okay, that was about the scales, and very important to remember the various types of scales and the disease conditions. Why? Because there is every possibility in the upcoming exam this question might be repeated. So in this MCQ, patient aged 60 years shows the lesions as depicted in the image below. Additionally, he reports that he noticed a spider crawling in the area of the lesion when he woke up. What is the most probable diagnosis based on this information? So what are you able to see is that there is a grouped vesicles which are present over an erythematous base unilaterally along a dermatome, and this is a very classic description of herpes zoster infection. Very, very important to remember. And this history of spider crawling over the body most likely is giving us a clue that it is some kind of a paresthesia, which the patient is experiencing, which the patient is experiencing due to the damage of the nerves in that particular dermatome. Okay. And herpes zoster infection, it is produced by varicella zoster virus reactivation. So in the primary infection, you all know that it is varicella chickenpox which is produced by varicella zoster virus. Later on, when it gets reactivated, as in this case in the elderly age group individuals most likely, or those who are immunocompromised, we are going to see this condition which is herpes zoster, which is also called as shingles. So till the time of reactivation, this is going to lie dormant in the dorsal root ganglion. It is going to lie dormant in the dorsal root ganglion. So this is the next image question. So 60-year-old male patient who is a diabetic presents with this progressive skin lesion. So it is progressively increasing in size. What could be the likely diagnosis? This is MCQ and you are able to see in the image that there is a ulcerative lesion. And please remember, in an elderly patient, if there is an ulcerative lesion, always think about basal cell carcinoma, which is also referred to as rodent ulcer, which is also called as a rodent ulcer. Remember, this is a locally invasive tumor where very, very low chance of metastasis is there. And this kind of lesion, whenever you see, mainly above the line joining the angle of the mouth and the tragus, the diagnosis is going to be basal cell carcinoma. Very, very important for you to remember. This is the next MCQ. A diabetic patient is presenting with the hyperpigmentation in the armpit. So what would be observed during a Wood's lamp examination? So by this time, if you are thinking about the diagnosis erythrasma, you are absolutely correct. You are absolutely correct. And on Wood's lamp examination, we are going to see coral red fluorescence in erythrasma. So erythrasma, eryth is red. And immunofluorescence is also red. Okay, very, very important. Rest of the immunofluorescences, where do we see yellow fluorescence? We are going to see in pityriasis versicolor. Blue fluorescence we can see in cases of tinea capitis. Green fluorescence is associated with Pseudomonas infection. In Pseudomonas infection. Okay, so this is the erythrasma showing coral red fluorescence in this patient in the axilla, in the armpit. And so this is a last question. So 10-year-old boy is brought with weakness in his lower limbs and a rash on the eyelids. So weakness is there in the lower limbs. So some kind of a muscle component is there. And a rash over eyelids, which is heliotrope rash, is present. So the diagnosis is dermatomyositis. So the examiner is asking, biopsy shows inflammation of the muscles. So obviously, because it is myositis, there is going to be inflammation of the muscle. What is the finding shown in the image below? So in the image, you are able to see that there is violaceous macular erythema present over the knuckles and also the IP joints and MP joints. So this is a classical finding which is referred to as Gottron speckles, which is in fact pathognomonic for juvenile dermatomyositis. Very, very important. We have discussed, we have seen what are all the types of lesions in the first question. So you can go back and revise all the features of dermatomyositis. So that's it in this PYQ session. I hope you enjoyed it. If you have any queries, you can reach me out on Telegram group of Cerebellum Academy, and I am easily available. You can tag me and ask me any question. So thank you so much. Happy learning. Bye bye.